Hello everyone, welcome to my YouTube channel. No one likes seeing red eyes, especially not in the mirror looking back at you. And why does it appear red? My dear viewer, it's Mercy Kemunto, your eye doctor and a cataract surgeon, ready to represent to you triggers of red eyes. Most of the time, the redness usually harmless and usually improves by itself depending on the cause. It can also appear suddenly or develop over time, and it can affect one eye or both eyes. Sometimes, a red and painful eye can be caused by a particle such as a grit getting into your eye, which can be removed in the clinic with the assistance of an anesthetic drop. We put a drop and we remove it. The appearance of red eyes is caused by the dilation of small blood vessels that are located between the white part of the eye called the sclera and the loose tissue that is called the conjunctiva. This tiny blood vessel usually expands and become visible, usually appear reddish. And why does these blood vessels dilate and appear reddish? Stick around and let's continue learning. There are so many causes. I will discuss the cause in a simple language so that we are all in the same page. So my dear viewer, take a seat, take a book, take a pen, and let's learn. Number 1, allergies. Very common. Allergies in the environment cause irritation in the eye, causing the body to release histamine to fight off the allergen, which can cause the blood vessels in the eyes to enlarge and make them very visible and appear reddish. Allergens are things like dust, pollen, fuzz that comes from our lovely pets. They are very common things in the environment. Number 2, conjunctivitis. Also known as pink eye. Conjunctiva is the clear loose part on top of the sclera, which is the part of the eye that is usually loose, and under it is the tiny blood vessels. Conjunctivitis is an irritation or inflammation of the conjunctiva. It can be caused by allergies, bacteria, or even viral infections. Children get it a lot. It can be highly contagious. It can spread rapidly in schools and even daycare centers, but it's rarely a serious infection. It just needs to be treated quickly once it occurs. Number 3, swimming. Many people develop red eyes after spending some time in a pool. Redness occurs when chlorine that is inside the water gets inside your eyes, which causes irritation, leading to the blood vessels near the surface of your eyes dilating and enlarging, becoming visible. And point number 4, eye fatigue. That is lack of sleep. Our eyes work from the minute we wake up until the time we go to sleep. By taking a nap, you get your eyes to rest and revitalized. If you don't get enough sleep, your eyes will show. Inadequate sleep tend to increase blood and fluid around your eyes, and this makes them appear puffy and red. Point number 5, alcohol and cannabis. Drinking alcohol can cause some people to develop eye redness. This is because alcohol can cause vasodilatation and widening of your eye blood vessels, and this will make them visible and red. Also, alcohol is dehydrating, can cause the eyes to appear red and tired. Also, when using cannabis, it also causes red eyes, whether you smoke it or consume it, even if it's an edible one. The redness occurs because compounds in the cannabis plant known as cannabinoids cause vasodilatation and thus present with redness. And point number 6, photokeratitis. It is a painful condition that occurs when your eyes are exposed to the UV rays that come from the sun. It also presents with redness. UV rays naturally comes from the sun, but usually resolves within 48 hours when you're exposed and causes photokeratitis. If it persists, an eye specialist is a must to be able to check your eyes. Number 7, subconjunctival hemorrhage, also known as bleeding in the eye. This one appears completely red. It is literally bleeding. It occurs when those tiny good blood vessels beneath your conjunctiva burst, and it's usually triggered by sneezing, coughing, heavy lifting, and even vomiting or rubbing your eyes too hard. The eyes are very delicate. They should be handled with care, or else they will start to bleed by just rubbing too hard. Other causes can be some medications, e.g. the blood thinning medications. A bleeding eye looks scary, but it usually does not cause permanent harm to the eye. But it's always advisable to go for a checkup to be examined, both anterior chamber and posterior chamber, to also check your eye pressure to rule out any cause of damage. Number 8, smoking. Smoking cigarette releases several harmful chemicals that can irritate the sensitive tissues of your eyes. Exposure to these chemicals like ammonia and hydrogen sulfide that comes from the cigarettes, to mention a few, can cause eye irritation leading to redness. And number 9, frequent use of eye drops. So many people are culprits to this. Remember, red eyes are just symptoms and not a diagnosis. Many people present with red eyes and rush to the over-the-counter medications for relief. It's not a bad idea, but frequent use of these eye drops can clear out the redness, but can cause rebound dilation of the blood vessels, making the eye appear even more reddish. And also, whitening eye drops. They're the same drops that we get over the counter and clean to whiten our eyes. These drops contain vasoconstrictors or chemicals that shrink the blood vessels on the eye's surface that reduces the redness. These drops eliminate the red eyes but fix this temporarily. Many people who regularly use these types of eye drops build up a resistance towards their whitening effects, which means that they will need to use more and more drops each time to achieve the same results. And what do we call this? Addiction to eye drops. And number 10, injury to your eyes. Injury to your eyes can be as simple as sticking yourself with a mascara wand. The beautiful ladies can understand this. You know what I mean? When you put in the mascara, it can accidentally injure your blood vessels inside your eyes. When you injure the eye, the blood vessels in the eye enlarge and dilate and become visible, which appear reddish. Dilation usually occurs and usually increase the blood flow cells to heal and repair the injury that has been caused for quicker healing. The dilation of the tiny blood vessels becomes visible and appear more reddish. The injuries can also include chemical injuries, and this is a medical emergency which requires immediate attention to prevent further damage. And point number 11, COVID-19, that is coronavirus. Studies show that eye symptoms occur in about 5% of COVID-19 cases. When the eye symptoms occur, they often appear before other systemic symptoms, such as fever and headache. You see, red eyes can be the first sign of COVID-19 symptoms. Most common eye symptom associated with COVID-19 is red eyes, but it normally resolves around the same time that other symptoms do resolve as you recover from COVID-19. And point number 12, Nephritis. This is inflammation of the eyelids. It presents with itchy, sore, red eyelids. It's caused by impacted oil glands that can't release an oily layer of the tear film well because it's blocked by infection or inflammation. This leads to swelling of the eyelids called blepharitis. This requires proper examination with an eye specialist and proper management. But to prevent blepharitis from appearing, usually maintain hygiene and not to sleep on your makeup on. And point number 13, dry eye syndrome. The tear have got 3 layers. We have the watery part, lipid part, and oily part. When the eyes do not produce enough tears, usually if it lacks the lipid layer, the result is dry eyes. Adequate and well-functioning tears are needed for the eye to be healthy and comfortable. Dry eye syndrome usually presents with redness, gritty sensation, you feel like there is sand inside your eyes, and also sometimes it can be accompanied by pain. Both men and women get dry eyes, although it's more common in women, especially those who have gone through menopause. As we age, we produce less of lipid layer of our tears, which puts us at a greater risk of developing dry eyes. Some medications we take also have side effects of dry eyes. That's why it's important to show your eye specialist the medication so that you can be able to be helped. And point number 14, corneal ulcer. Corneal ulcer is usually very sensitive and it will prompt to see the eye specialist evaluation and also for proper management because it usually presents with a lot of pain. Many patients with corneal ulcers appear at the eye clinic covering their eyes because it's usually with a lot of pain and it doesn't want to face the light. Because of that pain, they will prompt to get over-the-counter medication, but it's not advisable. Corneal ulcer usually presents with red eyes, eye pain, excessive tearing, and even sensation of a foreign body inside your eyes, and also it can also present with blurry vision. So corneal ulcer is very uncomfortable. You don't even want to even open your lids. There are special stents that we use in the clinic and equipment to examine corneal ulcer to see whether it's active. The reason for staining is to avoid drops like steroids during this active stage to prevent it from worsening. Steroid at this stage can cause increased breakdown of the epithelium layer of your cornea, which is the upper layer of the cornea. The steroid can also cause corneal thinning and even corneal perforation, which is usually managed by corneal transplantation, and it's very expensive. Steroids have got very bad side effects on the active corneal ulcer. Also, steroid can damage your cornea if it's instilled on an active corneal ulcer, and once it damages the cornea, even if you get proper management later, it will even heal with a scar, and the scar will interfere with your vision. So why go to that extent? Avoid steroids over-the-counter medication. By just avoiding the steroids over-the-counter, you will save your big time of going to the hospital on and off. And also, you'll be a happy person because you'll avoid so many complications. And point number 15, contact lens wear. Those people who wear contact lenses, sometimes it can irritate your eyes, causing the eyes to turn red. Some common reasons that contacts may irritate your eyes include poor fit of the contact lens can cause an irritation inside your eyes. Also, leaving the contact lenses in your eyes for too long than the recommended time can also irritate your eyes, causing redness. Traumatic removal of the contact lens also can cause abrasion onto your cornea, and so when you're removing the contact lenses, should be removed very gentle to avoid the abrasions. And again, wearing the contact lenses, when you're wearing it, can also damage the cornea, and this can irritate your eyes and cause redness. Poor hygiene, they can also lead to bacterial infection that usually presents with redness. So hygiene when you're wearing contact lenses is very important. And point number 16, inflammation of the eye, tissues. So I discussed about the parts of the eye. Those parts of the eyes, they have tissues which can also turn into red when they're inflamed. We'll mention a few. Uveitis. Uveitis is the inflammation of the uvea. Uvea is the middle layer of the eye that consists of the iris, ciliary body, and choroid. Uveitis presents with acute or even chronic inflammation. Acute uveitis usually presents with a lot of pain, redness, and increased sensitivity to light, which is usually called photophobia. Chronic uveitis usually presents with redness, but will usually have corneal inflammation. But sometimes the redness is not that acute like that of acute uveitis. This inflammation usually leads to complication if not treated early enough. Like, it can lead to clouding of the cornea, it can lead to cataracts, it can lead to elevated eye pressure, which is a condition we call glaucoma, swelling of the back of the eye, that is retinitis, and also it can also lead to retinal detachment, which is a complication that can lead to permanent vision loss if it is not treated early. And this uveitis is usually most frequently in people aged 20 to 60 years and affects both men and women equally. Another inflammation that is very common is episcleritis. This is inflammation of the thin, clear layer tissue that usually lies between the conjunctiva and the sclera. It causes mild pain, irritation, and red eyes. Sometimes usually become tender to touch. Another inflammation that is very common is scleritis. Also causes redness, but is usually deep red than episcleritis. It's deeper inflammation of the outer layer of the eyeball called the sclera. These are serious conditions and require proper examination and proper management because it involves medication with steroids, which needs to be handled with care. So, we'll talk about number 17, glaucoma. This is a serious condition. This is one of the severe conditions that can cause eye redness. Glaucoma is a group of eye conditions that can damage your optic nerve, the nerve that usually connects the eyes to the brain, causing loss of vision when there's eye pressure in the eye. In the eye, there is a fluid that's called aqueous humor. That fluid usually feeds the eye and removes waste from the eye. If the fluid does not drain well or enough, it increases in amount and increases the eye pressure because it accumulates in excesses in the eye. There is acute and chronic glaucoma. Acute angle closure glaucoma presents with a lot of pain and redness, but chronic glaucoma might not present with any symptoms until the optic nerve is damaged, of which transmits information from the eye to the brain and interprets once it's damaged, vision is gone. The sad thing is that once your optic nerve is damaged, you can never reverse it. Acute angle closure glaucoma is a medical emergency and must be attended by an eye specialist. It's an urgent medical condition for the eyes. Always be alert of sudden, painful eyes that are red, accompanied by seeing halos around lights, with blurred vision, accompanied with severe headache, sometimes with nausea and vomiting. But not to worry, all this information, I know it's a bit confusing. We'll discuss more about glaucoma in more videos that are going to come. But point to note, red eyes are usually nothing to worry about as long as they don't present with pain, loss of vision, and they're more sensitive to light. And also if it doesn't happen often or last long. I believe you have learned something from this video. It's a bit too long, but you can grab something of what is causing your red eyes. Give a thumbs up or subscribe. Share this video. You may never know who you are going to help around you. I appreciate you for being here. Until we meet next week, bye!